Hello, everyone. So we're back at the Arthritis Broadcast Network's hashtag CR Arthritis. We are now this afternoon with Dr. Elizabeth Stringer. And Dr. Stringer is an associate professor of pediatrics and a pediatric rheumatologist at IWK Health Center and Dalhousie University in Halifax. Nice to meet you. Thank you for being with us today. I know you're participating in two workshops at the meeting, but I'd like to first see if you can introduce yourself, your role, what's your involvement in rheumatology, and why you're here today.
So I'm a pediatric rheumatologist. I've been in Halifax, Nova Scotia for almost 15 years now, and my practice is a combination of clinical practice, so seeing patients, children, families with various rheumatic diseases, and I'm also a clinical researcher and do a lot of collaborative work with the Canadian Pediatric Rheumatology Research Community. But over the last number of years have developed a particular interest in Lyme arthritis, which is an infectious type of arthritis that is unfortunately endemic in Nova Scotia and some other parts of the country. And so that's been my, main clinical and research focus. As you mentioned, so I'm doing a workshop around that, and I'm also involved in a workshop on shared decision making. With a couple of patient partners and a researcher from Ottawa. And I'm here I love coming to the CRA. It's nice to see everyone in the community, learn new things, and connect with people to collaborate on various things. So I'm super happy to be here in person. It's the first in-person meeting I think that I've been at for many years.
Okay, so talking about the workshops you're participating in. So the first one is about Lyme arthritis, and so the title is Outcomes and Conundrums in Pediatric Lyme Arthritis. Can you tell us a bit more about Lyme arthritis?
Sure. Yeah. So Lyme arthritis is one clinical manifestation of a condition called Lyme disease. And Lyme disease is an infectious illness and is caused by a bacteria. That bacteria is transmitted by ticks, and ticks live in our environment and under certain sort of environmental, limitations. They need other animals to survive, so they have a blood meal on various animals, so mice and deer. And if a tick that's been infected with this bacteria called Borrelia happens to unfortunately bite or attach onto a human, that human can get this bacteria. And so there's many different clinical signs of Lyme disease. There's one that's a rash. You can get neurologic manifestations, and one common manifestation, particularly in children, is to get arthritis, usually in a knee joint, so a couple of knee joint plus maybe a couple other large joints, and it can look just like other forms of arthritis, which include rheumatologic conditions like juvenile arthritis. And Lyme disease originally was described in New England, and with climate change and just sort of the migration of ticks, Nova Scotia, which is the province I live in, is endemic everywhere. So everywhere in Nova Scotia, you are at risk for being bitten by a tick that could have Borrelia and subsequently get Lyme disease.
And so Lyme arthritis is especially in kids?
Lyme arthritis can present in any age group, but for some reason, when you look at the demographics of the population when they get Lyme disease, the cases that are reported, arthritis seems to be higher in children. So adults can get it too, but for some reason, children seem to be a bit more predisposed to arthritis as the particular sign of Lyme disease. They can have all the other signs, but arthritis just seems to be more common.
And so with climate change and the ticks multiplying everywhere, I guess we'll probably see more of that in the future.
Absolutely. So There's really 4 areas in Canada that are known to have Borrelia living in ticks. So that's Nova Scotia and New Brunswick is one area, and then southern Ontario, southern Quebec, southern Manitoba, and southern British Columbia. But we know that those tick populations are moving and northward, and so there's estimates that those tick populations could move by 40 kilometers a year northward, particularly with warmer temperatures, because they can survive longer. So more people in Canada will be at risk for Lyme disease.
So in your workshop, what do you think patients will be interested in knowing? What insights can they benefit from?
I think the first thing is awareness. So I think that's for the population at large, but also for pediatric rheumatologists. I mean, really all physicians that need to be familiar with different presentations of Lyme disease. I think one of the take-home messages for Lyme arthritis, in particular in children, is if it's recognized and treated with antibiotics, the outcome is actually excellent. Yeah. So the vast majority of the children that we see have complete resolution of their arthritis after treatment with antibiotics. So it's not a long-term condition like something like juvenile arthritis. However, there's about 10 to 15% of children, and probably all people with Lyme arthritis, who can be treated with antibiotics, and then it sort of transitions more into an autoimmune type of arthritis, and then it behaves more like a rheumatic disease. And so understanding how to treat that population or recognize them earlier is kind of one of my research interests.
All right, and so that other workshop that you're hosting tomorrow, I think it is, and it's about how to integrate evidence into interprofessional rheumatology practice, from clinical practice guidelines to shared decision making. Well, we interviewed someone from your group, Natasha Trehan from Take a Pain Check earlier today. So, from your perspective, anything that would be interesting for patients out there to know from that workshop?
So, I think. Well, the message that we're trying to impart to the health professionals working in that workshop is that making decisions about health really should be a joint decision between a healthcare provider and the patient. And we know from research that that is what patients want. There's different degrees of shared decision making, and I think that's one of the things that we're encouraging health professionals to ask about. So, maybe there are people who want to be less involved or more involved, but you'll never know if you don't ask. And then I think, secondly, I think there are some, people perceive some barriers, like there's not enough time, and that it sort of adds a lot to an encounter. But in fact, the research would suggest that it doesn't actually take a lot more time to kind of do a shared decision-making approach. And even if it is a bit more time, it's minimal. And I think the benefit of that approach is well worth that extra time.
Mm-hmm. Yeah, right. And so, is there anything else, any other insights that you'd like to give patients about how they can, improve their disease journey?
Well, I think in the context of shared decision making, I think it should be something that the patient feels that they can expect and that they're entitled to, and to, I guess, bring that up with their doctor if they're not feeling like they're getting information in the way that they need it to make a decision, that it's very much their right, and they should feel free to ask their doctor to explain it more for them, or whatever they need in order for them to make a decision that they feel good about.
Thank you very much. So, unfortunately, that's the time we had, but we have so much to say. Any questions from the audience?
I have one quick question. So, for someone living with Lyme arthritis, are they also at risk of developing symptoms of Lyme disease?
So, Lyme arthritis is Lyme disease. But Lyme disease is many different things. So, if someone has Lyme arthritis, it does mean that they have Lyme disease. But there are But with arthritis, when it's the symptom of Lyme disease, it's relatively, treatment with antibiotics is relatively successful, and at least in pediatrics, we don't tend to see children having sort of long persistent symptoms of Lyme disease, which is something, I want to study more, but my clinical impression after we've seen over 200 children with this condition is that they do really well and they don't have any long-term symptoms once the arthritis is treated.
Thank you. No other questions? No, so it's a wrap.
Okay.
Thank you so much for your time. Thank you for passing by the booth. Thank you everyone for watching. So.